Good afternoon. Thank you so much for joining us for our webinar on School-Based Health Centers 101, Partnerships and Pathways to Expand Students' Access to Healthcare. Next slide, please. Thanks, Andrea. My name is Emily Baldy, and I work at the School-Based Health Alliance. We are a national organization that works to support and advance school-based healthcare. We do this through some policy work. We offer standards to the field. We do data collection, which I'll share a little bit more about, and we provide training, technical assistance, and consultation to support school-based health centers from the planning stage all the way up through expansion and improvement. A little bit of housekeeping for our webinar today. All attendees are in listen-only mode, which means that you can hear us, but we can't hear you. We encourage you to use the Q&A icon that appears on the bottom of your screen. You can also use the chat function if there's something you'd like to share with us. If you'd like to use closed captions, you can do that by clicking on the CC button. Depending on whether your Zoom has been updated, this may look a little bit different for you. We'll have a set of, I think, 4 evaluation poll questions at the end of today's webinar. These are really valuable for us as we work to improve, and we encourage you to consider completing them. The other thing that's not on this slide, but that is important to share, is that this webinar is being recorded and will be both shared out to you via email and posted on our website. Our learning objectives for this afternoon or this morning, depending on where you're joining from. We hope that you'll be able to describe how school-based health centers increase students' access to healthcare, that you'll be able to identify at least 3 considerations for successful school-based health center startup, and that you'll be able to identify several no-cost resources available from our team at the School-Based Health Alliance to support your work in planning, implementation, and expansion. Our agenda for today, we're doing welcome and introductions now. Then you'll hear from me for a little bit of School-Based Health Center or SBHC 101, as well as some information about our framework for excellence and sustainability in school-based health centers. And then the part of today that I'm most excited for, we're joined by 2 fantastic panelists who have school-based health center startup experience, one from Washington State and one from Texas. We'll have some time to answer your questions, and then we will do reflections and closing. I'm going to launch a poll. When you registered for today's webinar, you told us a little bit about where you were coming from, but we know that sometimes not everyone who registers is able to join us. So I'm eager to hear from folks where you work and what your level of familiarity with school-based health centers is. That poll should kind of pop up in your Zoom screen. We'll take a moment to let folks answer so that we can see. I'm seeing a lot of health centers, federally qualified health centers. So glad you're here. I also see schools and districts, welcome, community-based orgs, government agencies, academic institutions. I see some primary care association responses, hospitals, health center lookalikes, private providers. So glad you're here. And then in terms of your familiarity with school-based health centers, a split, which is what we often see. About 30% say that they're new to school-based health centers. 31% work in a school-based health center. I'm hopeful that what we share today will be useful for you, even if you're already deep into the work. Some people have shared their community is planning a school-based health center. Some have school-based health centers. And some folks are here to learn about startup, others about improvement. That's great. Thanks for your responses. You may need to scroll down so that you can see the second question if that's not appearing for you. Someone asked in the chat, yes, you will get a copy of the slides. We'll send them via email and they'll also be posted on our website. Thanks so much for your poll responses. All right. Next slide, please, Andrea. Nancy's having a hard time scrolling down. Okay, thanks, Nancy. As I shared, I'm Emily Baldy. I'm a senior program manager at the School Based Health Alliance. I'm a social worker by training, and much of my work here focuses on supporting local level communities as they plan, implement, expand, and improve their school based health centers. I'm so delighted to be joined today by David Godinez and Laura Weishar. David is at Project Vita, a health center in El Paso, Texas, and Laura is at Community Health Center of Snohomish, a health center in Washington State. Oh, thanks, Rebecca, in the chat. It's nice to see you. Glad you're here. And I should say that there are several new names in the webinar for me today, some people I haven't met, and a handful of people that I have met before. I'm so glad that you have made an hour to join us this afternoon. David and Laura will each share a little bit more about themselves and their work when we get to our panel. But for now, thanks, Andrea, for moving us along. I'm going to do just a little bit of School-Based Health Center 101 and basics so that you can either situate the work you're doing within the national landscape or the work that you plan or propose to do. Ah, someone from El Paso. That's great. So glad you're here. We know that schools do so much to support students' health. We think about things like school nursing, school social work, school counseling, school psychology. And we also know that many schools partner with their communities to bring in primary care, behavioral health, dental services, vision care. We often talk about these two models as school health services, which we'll talk about on the next slide, and school-based healthcare, which we'll talk about on the slide after that. Next slide, please, Andrea. Thank you. When we talk today about school health services, we're talking about the services that schools provide to ensure that every student has access to a free, appropriate public education. This might include school nurses, school psychologists, school counselors, school social workers. And we'll talk a little bit more about this, but typically these providers are employed by the school and they operate under FERPA, the privacy law that governs education records. When we talk today about school-based healthcare, we're talking about healthcare that's provided to students at school by a community healthcare organization in collaboration with school administration and school health services staff. We often think about primary care, behavioral health, oral health, and vision services. It may be that these services are provided in a limited way. So maybe it's that a school partners with a local healthcare organization to do well child checks for their students, or there's a need for sports physicals, or when it's flu season, the community healthcare partner steps in. We're going to talk today about school-based health centers, which we think of as the most comprehensive or robust type of school-based healthcare. This is a collaborative effort, which you'll hear us say several times, among a school, a healthcare organization, and a community to make health services available to students at school in a consistent location on a consistent schedule. I know that students come to school with strengths and with health and social needs. We have a colleague in Georgia, Dr. Johnson, who is a fantastic provider and advocate for school-based health centers. And she often says school-based health centers work to maximize children's potential. We think of them as doing that by working across systems to address their needs. You'll hear us share a finding from the community guide related to health equity in a moment. We know that in order to achieve health equity, resources have to be allocated based on need. We're going to talk more about this today, but school-based health centers are planned and implemented at the local level to meet the specific needs of the children and families they serve. School-based health centers work to meet their students' needs related to physical health, behavioral health, and they also often work to address social needs. This is one reason we often say if you've seen one school-based health center, you've seen school-based health center. The intention is that they're designed with the specific needs of that student population in mind. School-based health centers reduce barriers to care for students and their families. This may be transportation. It may be the time to take off of work. It may be language barriers. It may be financial barriers. One of the things we'll talk about later is that School-based health centers serve all students, regardless of their ability to pay. The goal of the work is to ensure that all students have what they need to thrive. I mentioned that we would share a finding related to health equity. If you are needing to advocate for school based healthcare, or if you want to learn more, you may find the community guide to be a helpful resource. The Community Preventive Services Task Force develops guidance on which community based health promotion and disease prevention interventions work based on the available scientific evidence. They share out these findings via the community guide. There are a number of findings that you might be interested in related to school based health centers, but the two that we'll call out today are health equity and cost savings. You can read more at the link there, or you can scan the QR codes. I see that someone has raised their hand. If you have a question, I'd love for you to drop it in the chat or in the Q&A function. We won't be able to hear you, but if you drop it in the chat, we can be sure to take a look at it. I mentioned earlier that school-based health centers are a collaboration and a shared commitment among a school, healthcare organizations, and a community. I also mentioned that school-based health centers offer the most comprehensive type of school-based healthcare. So they're located in or near a school. They prioritize providing health services for students. Many school based health centers are also open to school staff or the immediate family of students or the wider community. And in those cases, they have procedures in place to ensure that students remain at the center. The federal definition of school based health centers is such that, at a minimum, they include comprehensive primary care. They might also offer things like oral health, behavioral health, at a minimum, primary care. And then I think we'll talk more about this. Thanks, Andrea, on the next slide, but they work with and don't replace existing systems of care. Some commonly asked questions about school based health centers. Importantly, parent and guardian involvement is crucial and encouraged. Their consent for services is required, except as allowed by state minor consent law. Although importantly, school based health centers don't necessarily provide services to which minors can consent under state law. There's a little nuance there. As I've mentioned, services are determined at the local level in accordance with state or local policies and laws. And there are some differences across states as it relates to confidentiality. School-based health centers do not replace school health professionals like school nurses, counselors, social workers, psychologists. And of course, they don't replace parents and guardians, a child's existing care providers, and other supports in the community. School-based health centers really are intended to be part of a larger constellation of care to help ensure that students who have access barriers can get their needs met. If you are in the planning stage, one thing to keep in mind is that school based health centers are a unique model of care. It's a unique provider role, and there are some differences on the administrative end as well. Providers need desire, time, skills for relationship building with students, families, school staff, folks in the community. They need to be comfortable including parents in visits virtually. It may be that a parent isn't able to come in person but wants to join on the phone, or it may be that a parent isn't able to be present. And so we need to do some follow up. We need to call the parent before the visit, depending on the age of the child, and we need to do some follow up after what happened. They also need comfort navigating HIPAA, the privacy law for healthcare, and FERPA, the privacy law for education. That provider role might include more consultation, crisis intervention, health promotion than a provider might do in another setting. Productivity and sustainability may be different. There's more coordination with parents. There is that time for getting to know school staff and do outreach. So it's a unique role. And I think that there are providers who are fantastic and so well suited for it. And it's really exciting when organizations understand we're providing care in a way that's slightly different. And so the way our providers work is going to be slightly different. You might hear us use the phrase health sponsor. I've also heard this called health partner. This is the organization that's providing the healthcare services. These are common roles and responsibilities. It may look a little different place to place, but generally speaking, this is what we see. The health sponsor manages the consent process. They employ, supervise, and credential the providers. They provide malpractice insurance. They bill insurers. They complete and update a pro forma or financial projections for the program. They provide the electronic health record, the medical equipment and supplies. They drive quality improvement. They do outreach, and they either lead or participate in a planning group or advisory committee. On the school side, perhaps most obviously, the school offers space, but perhaps equally importantly, they also implement policies that allow students to use the school based health center during the school day. They're an incredibly important part of that outreach. Families may already know and trust the school nurse or the front desk person or the attendant secretary. And when that person can say, "This is a resource that's available to you," that's so valuable. There should be someone at the school who has the capacity to act as a liaison with the school based health center. And this team also participates in or leads that planning group or advisory committee. Thanks, Andrea. We recommend that during the planning stage, school based health centers pull together a planning group. And then during implementation, that transitions to an advisory committee. You may decide that this list of members is valuable, or you might have additions or subtractions. We recommend thinking about someone from the health sponsor, perhaps a couple people, and then a couple of folks from the school district. It may be that it's helpful to have someone who does school nursing as well as someone who does school social work or school counseling. It may also be that you want a coach or a teacher or a secretary who has lots of insight. You might want to engage students, particularly if they're older students, their families, parents, guardians, other caregivers, youth serving organizations, community members. One thing that's not explicitly listed here, but that I would also call out, is other pediatric healthcare providers in the community. They will know your students. They might have really great insight. And it can be an opportunity to talk about how are we going to coordinate care, right? We're not here to replace or to take patients. We're really here to work together and help fill gaps. Planning groups and advisory committees do different things in different places. Some typical responsibilities include facilitating communication between the school-based health center and the broader community, helping determine the school-based health center's vision and mission, offering input into marketing and services, helping gather feedback, working on fundraising, and advocating for school-based health centers. I just saw a question in the chat about the slides after the meeting. Yes, we will share them. I also saw someone shared that their school-based services include nutrition via telehealth. That's really neat. Thank you for sharing that, Nancy. Yeah, and then to the comment about school-based health centers nearby, we're going to talk about the school-linked model in a little while. Thanks for your feedback in the chat. It's helpful. We sometimes share this slide about school-based health center sustainability with a huge caveat. This is based on what we have seen over the years, and this doesn't represent everyone's experience. It could be that you have a smaller school and are able to sustain. Maybe that's because you also serve the community or school staff, or it could be that you have a larger school and you're still figuring out sustainability. But some general considerations we share. The first is readiness. We're going to put that on pause. We'll talk about it in a moment. A school population of at least 750 students can often support a full-time provider and a support person like a medical assistant. The 70% free and reduced lunch rate can sometimes be a proxy for Medicaid eligibility, depending on your sponsor type. I know we have lots of health centers here, so you'll know that you get an enhanced reimbursement rate for Medicaid. So for you, if a larger proportion of the students you're serving have Medicaid, that may help your sustainability. For other sponsor types, that picture is going to look different around reimbursement. If you have determined that there is a need at the school, and if you have been able to do some really solid outreach, you should work towards a goal of 50% of the students at the school being consented by the end of year one, meaning they've turned in a consent form. By the end of year two, that number should be closer to 70%. About half of the students who've returned a consent form will have a visit to the school-based health center. And we often say if they've had one visit, they'll probably have two more over the course of the school year. Again, your experience may be different, your mileage may vary, as they say, but if you're building projections, this can be a starting place, and then you can adjust based on what you know to be true in your setting. I want to talk just a little bit about readiness. Some of the things we think about: leadership support, both on the school end and on the healthcare end. Alignment in mission and vision. What is the work of the school-based health center? How do we hope it will impact our families? We have a colleague in Massachusetts who talks about how mission and vision alignment has been so essential for the school-based health center she has developed in working through sticky stuff, right? When we're 2 years in and hard questions come up, if we're aligned on mission and vision, we can come back to that and say, here's what we've committed to. And so we know we can solve this problem. I wouldn't underestimate the value of developing that together and revisiting that commitment as you need to. Ensuring that the partner who's providing health services has a solid reputation in the community. I see a question about the consent form. I'm just going to put pause on that. I'm going to make a note. We'll talk about it a little during the panel, um, but I'm writing it down so that I don't forget. Thanks for that question in the Q&A. Organizational capacity means that there are staff on both sides who have some time that they can dedicate to this project. Space for the school-based health center, it doesn't have to be perfect, and where you start doesn't have to be where you end, but you do need to have a space where you can start that's acceptable on both sides. And then outreach capacity. We'll talk much more about this in our panel, but school-based health centers are a great example of it is not true that if you build it, they will come. It's so important that families and students know what's available to them. Maybe that they have the opportunity to see the space or to talk to the provider or medical assistant or receptionist to get comfortable. It will be important to plan for lots of outreach, both at the start and in an ongoing way. I'm going to share just a little bit of information from our national census of school-based health centers. Historically, we've done this data collection every 3 years, and it provides some detail on the school-based health center landscape across the country. You could go one more, Andrea. Thank you. Our 2022-2023 census of school-based health centers includes about 1,500 school-based health centers across 47 states and the District of Columbia. This is about 40% of the school-based health centers that are known to us. So it's important to know that these findings represent those who answered, but may not represent the whole field. About 8 out of 10 schools served by school-based health centers were Title I schools, and about 7 out of 10 students in schools with access to school-based health centers were Black, Indigenous, and people of color youth. Most school-based health centers are open full-time. When we look at school-based health center delivery models, most fall into what we would consider a traditional school-based health center. This means a fixed site on the school campus. Importantly, this category also includes hybrid. So there's some in-person care and maybe there's some telehealth, or it could be 100% in person. This 92% subsumes them both. So the person who shared in the chat that they have nutrition services via telehealth, that would fall into traditional because there's some in-person care and then some provided via telehealth. About 4% are what we call school linked, meaning that it's a fixed site near the school campus. Importantly, there are some logistical considerations in this model. Getting children off the school campus and then back to the school campus can take lots and lots of planning, coordination, and some resources. About 3% of school-based health centers that responded were mobile, meaning that they have a mobile van or unit that parks on or near the school campus. And then a very small percent, 2%, were exclusively telehealth. We mentioned sponsors, right? The organization that's providing health services. To me, there are two takeaways from this slide. The first is that if you look at the purple, which is our more recent data, most school-based health centers, more than 60%, are sponsored by health centers, also called federally qualified health centers, community health centers. Um, a couple of guesses as to why this is. The first is that there's federal funding, or there has been federal funding for health centers to start school-based health centers. They may have some sustainability advantages because of their enhanced Medicaid reimbursement rate, and they're part of the healthcare safety net. So their mission aligns with the mission of school-based health centers, serving all students. And the second takeaway is that there are lots of other sponsor types that are successful. We see hospitals, health departments, occasionally school systems, and other agencies. I have most often seen this as nonprofits. Trends in staffing models. I would just look all the way to the right in the 2021-22 section, where you can see that most school-based health centers offer expanded care, primary care, behavioral health, and some additional services: oral health, vision care, nutrition services, health education. You can also see that over time, more and more school-based health centers have started offering expanded care. That's that light blue bar. I mentioned earlier that school-based health centers support students' health needs, but we know that they also can support family social needs via things like support for health insurance enrollment, support with food insecurity, help with transportation, immigration-related support, legal support. Um, so we might get to that in our panel, but school-based health centers are working on supporting their students' health and are working on meeting other needs as well. I'm going to talk a little bit about our framework for excellence and sustainability, and then that will guide our conversation with Laura and David. To determine how best to describe the qualities and practices of successful school-based health centers, our team at the School-Based Health Alliance partnered with school-based health center practitioners, administrators, leaders from the states, and other experts in the field, as well as doing some literature review. And where we landed is this framework for excellence and sustainability that has two pieces: the core competencies you'll see on the left, and the nuts and bolts you'll see on the right. We're not going to talk in great detail today about the core competencies. If you go to the next slide, Andrea, we could see it a little bigger. Thank you. The core competencies are principles and concepts to excellence. They're access, student focus, high quality care, collaborative school partnerships, school wellness, systems coordination, and sustainability. We're not going to talk in great detail about them today, but at that link, which we'll share out with you when we share the slides, you can learn more. We are going to talk today about the nuts and bolts of sustainability. These are the practical aspects of working toward a program that is able to meet students' needs over the long term. Strong partnerships, sound business practices, and high quality practice. You might notice that these are represented like cogs. All three of the nuts and bolts are interconnected. So your work on partnerships will impact your business practices and vice versa. So we're going to talk about them as though they're distinct, but we know that they're really interconnected. Okay, now we're going to get to what I think is the fun part. I am going to invite David and Laura to introduce themselves and talk a little bit about their work, and then we'll have time for some detailed questions. As we're talking, you're welcome to drop your questions in the Q&A or in the chat, and we'll do our best to get to them. So David, we'll start with you if you're ready.
Of course. Hi, everyone. Good afternoon. It's really great to be here. My name is David Godinez. I am Co-Chief Programs Officer for the newly rebranded Project Vida Campus Care Program, which is the school-based program in our agency. We are partnering with 5 school districts locally, and we provide both behavioral health and primary care services in our sites or the partners that we work with. We have different staff in our team. We have LCSWs or licensed clinical social workers. We have LPCs or licensed professional counselors. We also have a pediatric nurse practitioner, a physician's assistant, medical assistants, community health workers, navigators, and then some management staff as well. Who can receive services in our sites? Well, mostly students, but this school year we are opening services for staff as well, only primary care services for staff in our campuses. We're really excited about this, and our partners are as well. And well, we've been doing this for quite a while now. It's been like 7 years. We've grown from providing services in one campus, and we are now offering services to over 20 campuses, and we expect to close the year with over 30 schools that we will be serving. So that's Project Vida. That's what we're doing over here in El Paso.
Thanks, David. And before we turn it over, excuse me, I should share that I met David and Laura both when they participated in the first cohort of our school-based health center startup learning collaborative, which we'll talk more about. But each of them are at kind of different stages in terms of their organization's journey. And so I'm so excited to have David, whose team has been doing this a little longer, and Laura, whose team is a little bit newer. So thank you both for being here. Over to you.
Hi, everyone. I'm happy to be here as well. My name is Laura Weishar. I'm the program manager for the school-based health centers at CHC of Snohomish County. We are a suburb of Seattle, right outside of about 30 miles outside of Seattle. We are on the other side of the spectrum of David's organization, where we are really new with our school-based program. We are entering our second full year with 2 school-based health centers and are going to end the school year with 4. It's been really exciting to learn from all the organizations nearby. King County has a really nice, a large organization of school-based health centers. We've learned quite a bit. And with us having a really established clinic system in the community, that has been really helpful with creating these connections and building, our patient base and getting the word out. Our school-based health centers right now are offering dental for 1 day a week and medical for 4 days a week. So we're fully staffed. And we also partner really closely with our dental outreach team that does dental cleanings and screenings at 52 elementary schools in the community. So that definitely helps with feeding our high school base. Our school-based health center also serves the immediate schools of the districts we're in. So we see elementary and middle school students. We work really closely with the school and their counselors and the nurses as far as transportation and getting these appointments scheduled. I really think that in the best learning we've had with the collab with the School-Based Health Alliance and in the first 2 years is that those relationships have been so key. Building relationships with the school, with the students has really helped with, getting the word out, creating ideas, finding opportunities where we could help out more, and it's been really exciting.
Thank you. I think that's kind of a good segue to where we're going first, which is strong partnerships. If you were a keen observer and a spatial person, you may have noticed on the preceding slide that showed all 3 of the nuts and bolts that strong partnership was in the center, and it was the largest. This is because we know, as Laura said, that it's the most foundational of the 3 nuts and bolts. So I wonder if either of you is willing to share a little bit about what your planning process looked like and who the partners were that were involved in that. And I know that at different schools that probably looks different, but any wisdom that you want to share about how you partnered through planning. And then I have some questions I want to ask each of you about how you partner now.
Laura, would you like to go first?
Sure, I can go first. So we really exist because of one of our school nurses. She worked at a school-based health center in a nearby county, and when she started working at our school district, she really wanted to see this model brought here. So she did outreach to all the community health centers in the area to see if there was anybody who would start this partnership. So that is just, she's just, we really wouldn't exist without school nurses, but she's definitely an example of that champion for a school-based. So once we were able to get established, we did create this advisory committee with some partners at the school district. That included their comms people, their anybody that helped with building maintenance, that helped us find spaces and access for having our vaccine fridges. And then once we were more established and we had our spaces built for our clinics, then the school nurses and the teachers and student organizations were key in getting the word out and building that engagement and kind of getting to know everybody. We have this we like to have an open door, like that's the thing, but we literally like to have people come sit on our couches. We have really comfy couches because that's how we like get to know everyone in this at the school and help build everything.
I love that. Thank you. And I love one highlighting like yes to school nurses, right? How what an amazing partner and that she had this vision and really worked to make it happen. And also my colleague Paula, who I don't think is on with us today, often talks about a spark for the school-based health center. And it sounds like that school nurse was the spark in your community.
Absolutely.
Thanks, David.
There were a few turning points for us. Our agency had been trying to work with school districts since 2010. And what we were trying to do was to provide teen pregnancy prevention education for a long time. And, there was some degree of success, but then it turns out that one of our program directors in the agency had children in one of the schools of the participating district, and she was acquainted with the principal at that school. There was a federal program that offered funding to implement a broader teen pregnancy prevention program, and she directly went to the principal and said, "There's this opportunity. We need a champion in the school district to advocate for us." And he bought into the project, and then we applied for the grant and we started implementing it. So that's the first turning point. Second turning point was while we were doing this teen pregnancy prevention program, our goal was to provide education, evidence-based curriculums, have office hours on campus so students could approach us and ask questions about the lesson in a private setting. And we also had a referral linkage program. So while we did not offer the services on campus at that time, we had community clinics. So our goal was, let's talk to kids if they want any uh, resources like pregnancy tests or STI tests or things of that sort. We'll send them to one of our community clinics. But what we started noticing was that students started showing up with different concerns rather than showing up to their office to talk about their sexual health. They needed behavioral health supports. So we started to notice this second pattern. And the third turning point, which unfortunately was tragic, was that there were several students that lost their lives to suicide in a single year in that school district. And that really catalyzed this whole movement and helped school boards, school administration, our own agency realize the importance and the urgency to bring behavioral health services to schools. So that really opened up the doors for us, and we established a relationship, a very close relationship at the district level with the director of guidance and counseling. Tammy McCabe. She continues to work with us. She's the person that oversees all school counselors in the school district. And that was kind of our entrance into the school district at all levels. So when we think about partnerships, we think about the partnership that we have directly with the community. We think about the partnership with that we have at the school level with principals and with students and with families. And then we think about the partnerships that we need to establish at the district level. So, for example, the school board or directors of guidance and counseling or the directors of nurses. So, those are some of the ways in which we started to build those partnerships.
Thanks, David. Andrea, I might ask you to stop sharing just so we can see everybody's faces bigger. Thank you. I know that the Snohomish team is doing some really cool work around partnering with youth. And I'd love for you to spend a little bit of time sharing about what that looks like and also how you have made that happen process-wise.
Yeah, so this definitely came about towards the end of the school year. So this is just an example of how those connections and relationships just keep growing. Someone from the school district connected us with the tech program that is ran by the school, and they do paid internships over the summer. So we were able to help the school with recruiting and created a curriculum for some students over the summer to help us with marketing and outreach. And we were able to get two student interns that were paid by the school district that worked with us to help build all of this content and information so that we could have campaigns that were more relevant to the students. They had excellent ideas of how we would connect on different topics, and some of the classes that they thought would be really interesting for us to host beyond doing just appointments for them. So it was a really we're just starting school, so we're really excited to incorporate some of these campaigns that they've created. And then they also were able to identify a lot of different groups of teams within the school that would be really helpful for us to partner. These are all entirely student focused groups. So we already had partnerships with our HOSA team, which is future health professionals. But they also wanted us to connect to certain STEM teams, also to their feminist groups, and also some of our team. They're huge readers. They're like, join our reading group. They just really wanted us to sort of build community with the students, and that really helps, especially the staff that's at the school, feel more comfortable and create those relationships with students that even just show up to say hi every day. So it's been so key. We're really excited to have some actual actionable items and campaigns created by students and seeing how we can incorporate those.
Thanks for sharing. I love that. And I think it also speaks to one of the things that we were touching on earlier, which is that this is a unique role. And it might be that your school-based health center provider or medical assistant or coordinator goes to book club. Right. And your organizations will have to determine what feels possible. But I think that's such a beautiful example of engaging young people in a meaningful way, being able to pay them for their time, and learning some stuff that you wouldn't have known otherwise.
Absolutely. They really reworked all of our marketing content and gave us some really unique ideas that we wouldn't have thought about, and keep us young. I think we have a pretty young team, but they had some really funny things to say about our millennial marketing.
Yes, yes. I have a lot of additional questions about partnerships, but I want us to get to consents and sustainability. I know one of the things that we talked about during the Learning Collaborative was the consent process and what was working and what could be improved. And so I'm curious, what have you learned about the process of developing a consent, sharing it with families, helping them understand what it means, and making it simple for those families who would like to opt in, to be able to access that form and get it back to you? Any consent insights that you want to share?
Yeah, I'll go. We reworked our consent form halfway through our school year last. We were using our main clinic consent form, which was sometimes a little bit too long, especially when you're giving students consents to take home in their backpack. They would forget half of the form. So we worked with our compliance team to condense the form as much as possible, to add consent for all services in one form, and also to add wording to say that the consent was then in place while the student was enrolled in the district or within the school. So that was really helpful. We got a lot more return when our forms were a lot more condensed. And then we also started adding digital forms through JotForm. And that has been so key, because especially if we have a referral from the school nurse during the school day, we're able to send a link to parents to our JotForm. They're able to fill it out on their phone, and we have a consent that's good for the time that the student is enrolled. I think that has been the easiest way to get these consents. We also have QR codes of these these QR codes are posted all over the school and all over the school websites. Well, the school websites have links to these forms so that they can sign up without having to come to the clinic. And yes, JotForm does accept virtual signatures, and they are HIPAA compliant.
Thanks, Laura. And the one thing I'll add, which I know you know because it's in your form, is just like at your regular doctor's office, there's a part of the consent form that gives parents instructions on how to revoke consent. So in the event that things changed and they did not want their child to receive services anymore, the process for that is spelled out in the consent form. So the length is longer and parents know how they can revoke that if things change and they need to. David, anything that you want to share?
Sure. We are also working on developing a consent form that's what they call an evergreen consent form, which can be in place for several years in a row. And what we've done so far is we've uploaded our existing consent form to the parent portal, which is part of the student information system. And what we do is that basically during registration season, which normally starts in April, the school district helps us remind parents that the services are available to them and that they, if they're interested, they can fill out the consent form in the parent portal. They have been instrumental in reminding parents that that resource is available to them and sending it through email blasts to everyone. That's for the primary care services. For the behavioral health services, we operate on a referral basis. So school counselors are the first point of contact on campus for any mental health concerns of students. And they assess if the student might benefit from mental health services, and if they do, or if they can benefit from mental health services, they call the parents, they explain the service, and then if the parents wants to hear more about it, they fill out a referral form and they send it to one of our staff. A community health worker who is a navigator receives that consent form and calls the parent, explains the services, explains the consent form, sends it out for signature, or schedules an appointment on campus with parent to go over the documents and get them signed. Then we upload everything to the electronic health record. I want to add that another very important piece of information for us, or documentation for us, is releases of information to allow communication between our providers, our navigators, and the school staff, like school counselors or school administration. It's important that parents are aware of the type of information we might share with them, and that they consent to it. And that way, we can keep that communication open at the school level. And schools really like this because it helps them keep tabs on where their students are at. For example, we collaborate with the attendance clerk, or school counselors are very interested in knowing where are the students that they refer to us in the process of our enrollment and treatment. So this release of information allows us to share that information in a safe manner with our stakeholders.
Thanks, David. One of the questions we got was about school-based health centers seeing students without a parent present. Many school-based health centers see students without a parent present, right? When we think about reducing barriers, reducing the time that a parent has to take off work or find a ride to come to the visit is one of the services school-based health centers offer. There's consent in place, which is what we're talking about, and school-based health centers should have a process for how they let parents know their child is receiving care, how they follow up with parents about that care. There are some considerations related to confidential services, but just to sort of get at that question directly. I'm seeing some great questions in the chat. I want to make sure that we get to talk a little bit about sustainability. And Laura, thank you for dropping your info in the chat. I want us to talk a little bit about how your school-based health center works toward financial sustainability. So do you bill insurance? Do you have grants? What does that picture look like? And then how do you talk with your education partners about what sustainability means for the school-based health center? I'll ask you to be fairly brief because I want to make sure we have a couple minutes to wrap up.
Sure. We always say to everyone at the school and all of our materials that are provided to the school that the school-based health center is free of cost to students and their families. But we have told them that we will bill insurance if they have it. If they don't have it, then we write off the cost. But we also have a goal to connect anybody who is uninsured and eligible for insurance to our patient service department, who will help students sign up for insurance. That helps us to then in the future have more insured students to be more sustainable. We also do receive grants from various sources depending on what we're focusing on. So if we have one for dental outreach and for behavioral health expansion.
On our end, we have a kind of a split where we have established a goal of gathering about 70% of our costs through revenue and about 30% of our costs through grants. So we get state grants and federal grants to fund our operations. And then we also keep track, very close track of our productivity and the revenue that's coming in. We need to balance a few things. We want to make sure that we're offering quality care, that the services that we offer and the standards of productivity that we set for ourselves are reasonable and feasible in a school setting, that we are taking employee well-being into account, but also keep in mind that we need to keep the lights on. So I would say the first things first, you need to know what your bottom line is, know what the cost of your program is. So you strategize on where you're going to gather the funds, if it's going to be through revenue or grants, or even getting donations or financial assistance from school districts, which we've had the opportunity to do. So that's a very broad explanation of how we approach sustainability.
Yeah.
I think that's really, go ahead, Laura.
Yeah, everything that you were just mentioning, David, was really helpful for us last year when we did the collab with the School-Based Health Alliance, and they had templates for pro forma to figure out what your bottom line is, figure out what your operating costs are, and start establishing these goals. That was really helpful for us since we were early in the process.
Thank you. I see some questions in the chat about billing. I can share that school-based health centers generally follow their sponsor organization's practices. So those sponsored by health centers have access to a sliding fee scale, which they can offer to families. And I love, Laura, what you shared about emphasizing insurance enrollment. Like if families are eligible, how can we help get them connected? Some school-based health centers have grants that they're able to use to offset some of those costs to families related to things like copays. I want to do a little bit of sharing resources. So if you can hang tight, I might come back to you, but I want to make sure that we have time to let folks know what's available to them. Andrea, if you could share, thank you, the slides. Yeah, we're on resources and opportunities. That's perfect. Laura and David did a beautiful job of sharing their experience in our school-based health center startup learning collaborative. This learning collaborative is offered at no cost. Teams must include at least 2 folks from the health sponsor, and at least 1 person from the school district. This is intended for those who are either in the planning process or in the process of expansion or improvement. Applications are due September 17th. We will drop in the chat the link to learn more and apply. But if you're in the process of planning a school-based health center, we hope that you'll consider joining us to learn from peers. We have some fantastic expert faculty. We would love to get to know you that way. Next slide, please. These slides highlight a couple of resources that are available to you. We'll send this out and there are links, some stuff related to partnering with young people, better partnering with your schools, and also connecting to resources at the state level. Next slide, please, Andrea. We have some fantastic toolkits related to quality improvement, both around business practices and sustainability. We did not talk very much today about high quality practice, but I encourage you, if you're interested, to take a look at some of the quality counts materials. Our colleagues in our quality department do a great job, and they are quite practical and useful. I'm gonna press pause on our Zoom poll because we have a couple minutes, and I want to ask Laura and David if there's one thing you'd like to share that you're really proud of about your school-based health work, or if there's one lesson learned that you would pass along to a younger sister or niece if they were getting into this work. What would you share? Something you're proud of or a lesson learned?
I would say that I'm really proud of our team being flexible and keeping the fun. I think that's really important. It's so unique for us being with students and an environment that's not normally as clinical. So that's been really fun to establish that environment. But also the biggest lesson I would say is to encourage those relationships with the school, create more with community partners, and also work with other organizations that can help connect students. So we collect resources for housing, food, anything else that you can support your students from.
I would say lesson learned, relationships. It's key. It's going to open doors for you. It'll help make things flow better. It'll help you create better workflows. It's just key and probably the foundation of a partnership, any partnership with school districts. And I feel very proud of our team because they've shown a lot of resiliency and adaptability. The school setting is ever changing. It's very different from a clinic setting. So those are definitely qualities that need to be present as you implement and carry out these partnerships.
David, I want to acknowledge that there are some fantastic questions in the chat that we did not have time to get to today. We will take a look at them afterwards and think about if there's a way for us to share some information in follow-up with you all. But I'm hopeful that you'll have the opportunity to look at some of the resources that we send, because some of your questions may be answered within our toolkits and other resources. I'm going to launch a Zoom poll. As I shared at the start, your feedback is so helpful for us as we plan activities for the coming year, as we think about what was helpful and less helpful to people. So I'm going to launch that Zoom poll now. There are 4 questions. If you're willing to take a minute, we surely appreciate it. I think David and Laura, that you all were fantastic, and you're welcome to stick around, but also welcome to jump. I'm going to stop the recording. We'll give people time to complete the Zoom poll. To those who joined, thank you so much for being here, for your great questions, for your work to increase students' access to healthcare. We hope that you will stay in touch, and we hope to see you again soon. Thank you so much.
Thank you.